time around, it is not only about the men being excited. They should be concerned as well, because it's not just women who contract breast cancer. Men also do, and I'm sure you want to know how. So let's get into the conversation this morning. I've been joined in the studio by Professor Francis Hasford. He's Director, Radiological and Medical Sciences Research Institute, Ghana Atomic Energy Commission, and Mrs. Rita Ankwa. She's Senior Nursing Officer, GAEC Hospital. Yeah, that's the Ghana Atomic Energy Commission Hospital. Yeah, they're very close to me, my own people. Good morning to you, lady and gentleman.
Good morning, Lily.
How are you?
Fine, thank you.
Yeah, good to have you. I'm sure a lot of people, whenever we enter October, they say, oh, Breast Cancer Awareness Month, Breast Cancer Awareness Month. But after October, we go to sleep. For us as Ghanaians, but for you in the health fraternity, you don't go to sleep because you're always attending to cases. How, from where you sit and in this current age, how crucial is the statistics on breast cancer? Let me start with you.
All right. So I can take it, right?
Yes. Oh,
yeah.
yes.
All right. Okay. So good morning once again, and then good morning to all your listeners and your viewers. So the statistics are quite enormous. You know, cancer, first of all, has to do with abnormal growth of cells in the body, and it can happen in any part of the body. So one of such is the breast. And in Ghana, we record over 24,000 cancer cases in the whole country annually. Out of these numbers, about 5,000 of them are breast cases.
Did you say 24,000?
Yes, over 24,000 cases annually. Out of these, about 5,000 are breast cancers alone, which translates to about 20% of all the cancers that are seen in the country. So the numbers are huge, really.
And does it feel that we're fighting a lost battle? Because if the numbers, give me a trajectory of the data from, let's say, 5 years ago. How far have we traveled in terms of data? Is the numbers reducing? Are we seeing more people reporting? Are we seeing more people, getting aware of the disease?
All right. So the data that we had from World Health Organization and from cancer registries in Ghana, back in 2018, Ghana was recording about 19,000 cancer cases annually. As we speak now, we are over 24,000. So what it means is that the numbers are increasing. Yeah. And these are the reported cases. One thing that is striking is that 1 in 8 women will develop breast cancer in their lifetime. 1 in 8 women will develop breast cancer in their lifetime. And if you go to the facilities where we have cancer cases, the Kolebu teaching hospitals, the Konfanochi teaching hospitals, where you have the cancer registries, you would see the numbers, and then it strikes you that the numbers are increasing, and we need to really do something quickly, urgently about. And so this cancer awareness issues coming up in October is as a result of some of these things. And so agencies, institutions, organizations are coming together to create the needed awareness, and then also to advise on screening activities as well in the months. Because once you pick the disease up early, then you can treat and have successful treatments.
Now, Rita, let's talk about breast cancer. Anytime people hear breast cancer, there's a seeming fear. What is breast cancer?
Thank you once again. Breast cancer, just as Prof said, is abnormal growth of the cells. That actually can happen any part of the body, but this one in the breast. So if you want to really know as a layperson what really breast cancer is, I'll say what are some of the signs and symptoms that you look out for that will prompt you that there's something actually happening in my breast. And this one can be either a man or a woman, because research shows that 1% of the breast cancer cases are found in men. So it's not only the women we are talking about. So what are some of the signs and symptoms that if you see, it should actually prompt you? A lump or a mass in the breast. And for women, when you are ovulating or you are about to have your menses, your breast becomes heavy. Sometimes you kind of feel that there's a lump or you are feeling something inside. Most of the time, they are the lobes that you feel in the breast. But if you are able to examine your breast every month and there's any changes, whether it's a mass or a lump, you'll be able to detect it early. And then we also have the changes in the size and the shape of the breast. Most of our breasts, you realize that one side is bigger, especially the left side is bigger than the right side. But when there's a change, which is conscious, the size, you can't actually overlook the size. You realize that there's a change in your size, it has increased. And then we have nipple changes. Your nipple, if you examine your breast normally, you see that this is my breast. But if there's a change, that's why we always advocate that don't wait.
Does the change include color?
Yes, it does. It does. So that's why, like we say that if you examine your breast almost every month, if there's a change, you will see.
Yeah.
But if you wait till October before you do, if there's any changes, you wouldn't see much. By the time you realize you are at the end stage.
Yeah.
So we advocate that you examine the breast monthly, so that if there is any changes in the nipple, you realize that there's a change, and then you actually go to the hospital to follow up. And then there's the skin of the breast also changes. We normally have the skin of the breast being smooth. But when there's cancer cells multiplying, you have that, you have this skin color of the orange. You see that orange skin is, you have some dot on the skin, on the surface. When the cancer comes to the breast, you have these changes on the skin as well. And then we have tenderness and pain in the breast. This one is not the one that when you're ovulating or you're about to have your menses, you experience. No.
Okay.
So this pain is different from that one. So if you have persistent pain and tenderness in the breast, then please don't sit at home. Come to the hospital and let it get checked. And at times you have swelling in the part of the breast.
Okay.
A swell and a lump and a mass is different. Swelling, a lump,
Right.
Exactly. So if you see a swelling, don't just take it for granted. It can also mean that. And then the change in the skin over the breast as well. So monthly examination is paramount, so that if there is any slight change, you see it first. Yes.
Right. What factors make people susceptible to breast cancer in Ghana?
Yes, we have, I'll say some and then Prof will also add up.
Right.
We have a lot of genetic factors, age, susceptible things that actually make people prone to breast cancer. Some of them are controlled, others we can't control, like the age and the genetic. You can't control it. But overweight, being obese, especially after menopause, will actually make you prone to cancer because we're exposed to excessive estrogen that is produced by the body. And then if you are oral contraceptive pill for a long time, it will actually increase your risk, but then it diminishes after you stop taking the pill.
Oh, okay.
Yes, and then we have
So those
excessive,
of you who like taking oral contraceptives, lend me your ears this morning.
and then excessive alcohol intake
Say what?
is also a risk factor.
Is the excessive alcohol intake for women or for both gender?
For both, if only you have breast.
Okay.
And
okay.
since everybody
Everybody
has breast,
yes.
so it's for both. And then when you give birth after age 30, you kind of increase your risk. And then when you don't give birth at all,
Oh, really?
yes,
You increase your risk of
you
breast cancer.
increase your risk.
Why? Why is that so?
I would say that in a normal language, the breast is not in use.
Okay. Okay.
It's because we
But
have.
maybe they have a husband. The husband is using it. That was interesting.
Yeah, so that one too.
Because it's not the milk ducts are not producing.
Are not
milk.
producing.
Okay, okay.
Yes, so it kind of dormant, and then the cells can easily So that is the aspect. I think the risk factors. I'll let Prof continue
Yeah.
with.
Maybe I'll add two more.
Okay. Okay.
So lack of physical activities. Yes, because if the more you exercise, your immune system is active enough to fight against diseases. So that's one of them. The other one that has been topical lately has to do with environmental factors. And one of the key things has been the galamsey activity. The things we take into our body may harm or help us. So if you take toxic substances into your body, you are harming your body. And then it predisposes you from developing some of these cancers. What the lead, the arsenic, all the materials that we term as heavy metals that are heavily used in these galamsey activities feed into the food value chain. And so the one who is planting the crops are using the water, the produce are harvested. Maybe you are sitting in Accra, you think you are safe, but then you are eating, whether it's fruits or vegetables or whatever. Many years to come, you'll be developing cancer and you don't know where you are getting it from. So that is where this, and some studies that have been done, preliminary studies that have been done, is indicating to this point that we really need to pay a critical look at these galamsey activities and stop it immediately.
Now, some of the things that she mentioned was monthly check. Is that the only way for early detection?
Okay, so you take it.
Okay. So you can have your self-breast examination monthly. You can go to the clinic and have clinically the breast being examined. You can have a mammogram, that's after age 40. If you are not 40
Can someone
years,
do mammogram before age 40?
ideally it's after age 40. If you are not 40, then you do the ultrasound scan.
Okay.
That's also okay. Can determine. And then you can also do magnetic resonance imaging as well. And then you do genetic screening, at least to rule out whether genetically you are predisposed. So these are some of the things that you can do to actually rule out.
Prof, you wanted to add on?
Oh, no, she's
Oh,
covered.
okay. Let's talk about some of the general misconceptions about breast cancer. A lot of people feel that, well, I'll not even go to be screened because if I go and then there's cancer, I'll die. You know, some people feel that if I see anything in my breast, it is spiritual. There's so many misconceptions about breast cancer. Help us demystify.
All right. So, one, I like the point that you mentioned about these spiritual effects. You know, cancer in the few years past was seen more or less like a death sentence. Once you get it, it's like what they call a samayari or something like that. And so many families were not even willing to associate with their family members who developed cancers. Right now, because of education and awareness, now people are getting to understand it. But the fact that you are going for screening or you've been diagnosed of breast cancer does not mean you are going to die. No. Because now you have equipment, you have facilities that are helping to do this. The imaging equipments that are here, she mentioned a number of them. And then the treatment machines as well. So radiation treatment, if you go to Kolebu Teaching Hospital, if you go to Konfanochi, if you go to Sweden Ghana Medical Center, these are facilities where these cases are treated. And once you pick the disease very early, you have over 90% chance of treating. And so we have many patient survivors. The problem has always been late detection, advanced cases. The people report to the hospital, the case is very advanced. There's nothing that you can do about it. The only thing you can do is just reduce the pain of such people for them to die slowly. And it's difficult. If you are in the hospital working and you see such people, you know that this person is going to die. There's nothing you can do. Just ease the pain for the person. It's really difficult. But then we create the awareness that let's pick it up early, do breast self-examination or get an experienced person to screen you. If there's a need to do mammogram or ultrasound, that is done. You pick it up early, and then once it is picked up early, then you get it treated.
At what stage is breast cancer fatal?
You know, there are different stages: stage 1, stage 2, stage 3, stage 4, terminal stages, right? Once you are hitting beyond stage 2, it is becoming fatal, right? Stage 1, what it means is that the cancer is confined to a very small spot in the body. So either by surgery or by radiation therapy or whatever, you can easily, but once it spreads to other parts of the body. And so you may have someone develop breast cancer, and by the time you are aware, it's going through the body, it's affecting the lungs, the kidneys, all other organs. And so then it becomes difficult where to target and where to treat, right? And it passes through the bloodstream, and so it can go anywhere in the body. One key challenge has always been, especially this perception that you can pray and get the cancer disappear. And that is a very big worry. Mm-hmm. Some people report to hospitals early enough. They start the treatment. By the time you are aware, they abscond, only to appear when they are terminal stages where nothing can be done. And if you speak to such people, most of these people will tell you, I went for this prayer camp, I went to do this, I went for this herbal treatment. And at the time that the person is almost about dying, then they direct them to come to the hospital just to come in pass off.
Are you a believer in healing?
I am a believer. Mm-hmm. But, God works through human beings and systems that are created. So let's take advantage of these ones. We can pray, all right, to back the treatment that is being offered.
Yeah.
But to go and sit somewhere and just be praying throughout to get the healing, that is where the difficulty really is. And we really need to educate people on that a lot. Yeah.
Let's talk about the challenges therein when dealing with breast cancer care in Ghana. Is it very difficult?
Yeah.
Auntie Rita?
Yes. So it is difficult in a country that lacks the resources to deal with such, right? First of all, cancer treatment is expensive. It is very expensive. And so if you have a country like Ghana where most of the people are poor, don't have the means to afford such treatment, then it is very expensive, right? It is very difficult. Fortunately, there are some systems coming in to support here and there, but it is difficult. One, access to facilities is a challenge. What do I mean by access to facilities? So Ghana has a population of over 30 million. We have 3 radiation therapy centers that are treating cancers, apart from surgery. And so you can anticipate the pressure on these facilities.
That's 3.
That's 3, just 3. We have Konfanochi, we have Kolebu, we have Swedish Ghana Medical Center.
Wow.
Yes, radiation treatment for a population of over 30 million.
Yeah,
and
32.
Judging by the statistics that we are recording over 24,000 cancer cases annually, you can imagine the pressure that is on. And these are new cases that are coming because there are already people who have already been diagnosed and are going through the treatment. They also need to have time on these facilities for treatment. And so that is a big challenge for. But then we have recently, I think National Health Insurance rolled into their scheme some of the cancers, childhood cancers, breast cancer as well. So these are some of the interventions that are easing up the challenges. But I think there needs to be more than this. Yeah.
Is when somebody gets breast cancer, is there any chance for survival?
Yes. When it's detected early, you have a chance over 90%.
How early?
How early comes down to examine my breast every month. So if I examine my breast every month, and this month I felt something in, I'm not so convinced. I go, if I'm over 40, I'll go and do mammogram. If I'm not, I'll do the scan. Just like doctor said, at that stage, it's just at a small portion. Radiation can take care of it. If it's a lump, they will just take it out. But then if you wait, so that time I have over 90% chance of surviving. So it all comes down to examine your breast in October and beyond.
Beyond, absolutely.
Yes.
Because I realized that after October, a lot of people go back
Don't
to
do
sleep.
again. Yes.
They wait till October, and then they put pressure on various facilities for
Exactly.
screening.
So we shouldn't do that because we have, like Prof said, we have only 3 facilities. And these 3 facilities is not just, it's not cheap. Cancer is very expensive. Cancer is expensive. Yes.
And so you want to take advantage of the program ongoing at GAEC. Let's talk about what GAEC is doing.
Yeah. All right. So let me take that. So GAEC, every year, we've been organizing this breast cancer awareness and screening program. Last year, we were in your studio. We spoke about it. Yeah. So what we do is to dedicate the whole month of October for breast cancer awareness. Because of how successful the program went last year, this year the request is for us to include prostate cancer because then the men are disadvantaged. So
well, we were
so
screening
everywhere
their
we went,
breasts too,
everywhere we went, the call is that please add prostate cancer. And
Prostate
so
cancer.
this year in November, the whole month is also being dedicated for prostate cancer awareness.
Okay.
Yes.
Okay.
Yes, but for our plan this year on the breast cancer, we are screening and doing these awareness activities in a number of areas and in some institutions. So we are going to cover the Dome market, the Taifa market.
Which is today.
Yes,
Okay,
we started
okay.
today,
Today.
yes.
Okay.
As we speak now, our team
Yeah,
are
there.
on the grounds. So Dome market,
How long is it? So from this morning through till what time?
so throughout the day up until 4 p.m.
Okay. Okay.
So we are screening, we are doing the awareness at Dome and Taifa markets today and tomorrow.
Okay.
Next week on 7th and 8th of October, we are screening at the Kwabenya market.
Okay.
Yes. Then we moved to some corporate organizations. Fortunately, we had some organizations support us very generously, supporting us to do these activities. So we have G4 Securities, we have Ghana Gas, we have National Petroleum Authority, we have Free Zones Authority, we have National Health Insurance Authority, all coming on board to support us, including some other institutions at Ghana Atomic Energy Commission. And so we are going to go through all these organizations to screen and to do the awareness. And the screening is free,
Okay.
free of charge. Anyone should pass by to get screened freely. You don't pay anything, right? And we have medical team in case you are suspected to have any condition. There's follow-ups for you, right? And so it is a fully packed program in the month of October. But one of the highlight activities we are going to have, which is happening on the 11th of October, is the breast cancer awareness health walk
Okay.
through the vicinity of the Ghana
GAEC.
Atomic Energy Commission. So the so we are going to go through GAEC to Dome, to the Christian village, to the Westland Roads, to Hacho, and back to GAEC. It's about 15-kilometer walk.
So if it means that if you are coming from GAEC, it means you hit Hacho before you hit Westlands.
Yes.
Okay. So you hit Domi Pitla to Hacho Westlands.
Yes. So our starting point will be the GAEC hospital.
Okay.
Yes, your hospital.
Yes.
We are going to start from there. We'll move to what we call the atomic roundabout, the atomic down, then all the way to the Dome, to the Dome crossing and the Dome market area. Then take the left turn towards the Christian village road. Like you are hitting Achimota, then you take the left turn towards the Westland roads, then all the way to Hacho.
Yeah, then back to GAEC.
Yes.
Okay.
So it's 15 kilometers. And I know, Lily, you are going to join us.
I will. I really want to be part
Sure.
of this. It's something that I want to be part of. It will be interesting too, because I think that as a country, where we have come from, we should not be experiencing more breast cancer cases. If we're anything at all, we should be reducing the numbers.
Yes.
Because if we have 5,000 people with breast cancer every year, that's scary.
What it means is that 6 women die of breast cancer every day in Ghana.
6 women.
6 women die of
Daily.
breast cancer daily in Ghana if you do the computations. And so it is, you see, sometimes when you speak with the figures, then people get to know how serious this is. Yes. 6 women.
That's serious.
Yeah.
Okay. But if anybody wants to walk throughout this month, can anybody walk into GAEC for breast cancer screen?
Yes. For this month and beyond,
Okay.
you can come to GAEC Hospital and get your breast examined and screened.
Okay.
After October, you can walk in. And then a doctor will see, a nurse will see you. We have professionals there that are working. And it's not only the breast aspect that we do, it's a whole hospital. So any health need that you have, just come to GAEC Hospital and you meet good professional doctors and nurses that will take very good care of you.
All right. Thank you very much, Prof. and Mama Rita. I'll see you at the facility.
Sure.
Yes, but just before we go, I would want to acknowledge the contribution of some people who are behind us to make this possible.
Absolutely.
I made mention of some of the names. We have the NHIA, the Kwabenya branch. We have Ghana Gas, Ghana National Gas Limited.
Yeah,
We have
and
National
good morning to
Petroleum
Dr.
Authority.
Bonasante. Yeah.
Yes, supporting us hugely. National Petroleum Authority. We have the G4 Securities. We have graphic communications group. They are also helping us a lot. We have Free Zones Authority, and then we have Medicas Hospital, as well as Health Essentials. Health Essentials is also behind us and giving us medical team to undertake this activity.
You forgot to mention us.
As well as GAEC, the German development company, and finally Star FM for granting us this platform. And I know we are going to be interacting more.
Of course.
Yes.
In the coming days, it's
Sure.
important that we do more education, especially as we are in October and even beyond, so that people can early detect, so we can save people's lives early. Thank you very much, Prof. And thank you very much, Mrs. Rita and Crash, Senior Nursing Officer, GAEC Hospital, and Professor Francis Hasford is Director, Radiological and Medical Sciences Research Institute, Ghana Atomic Energy Commission. They are my neighbors. So I'll see you back at home.
Sure. And we'll see you during the walk.
Absolutely. I'll be there. Thank you very much. Have a great day. So this is still Star 103.5 FM. We're simply the best station.